The Genuine Article. Discussion and commentary based on articles from Jack.
Hello, I'm Tony DeMaria, the editor of Jack, here with Inside Jack, and I'm interviewing Dr. John Camm, professor of medicine at St. George's Hospital at the University of London. And Dr. Camm has been the first author of an important paper that followed a very large registry data of patients with atrial fibrillation to compare that persisting question as to whether or not these patients are better treated with rate control or rhythm control. John, tell us a little bit about the registry.
Well, this was a registry approach to trying to identify which strategy might be best for treating atrial fibrillation. We chose it because controlled randomized trials often exclude all sorts of patients that cannot be investigated in that way. So we took some 5,000 plus patients with atrial fibrillation that had been present for less than 1 year, and the atrial fibrillation had to be non-permanent, that's recurrent forms of atrial fibrillation. We then asked their physicians to choose whether they should be managed with rate control or rhythm control, and we followed them for 1 year.
Now, how successful were these therapeutic approaches? Was the rate control and rhythm control approach approximately equal in their success at the end of 1 year?
Well, interestingly, a slight majority of physicians chose rhythm control over rate control. And the first point of assessment that we wanted to make was whether the physicians managed to achieve rate control and rhythm control according to guidelines. So we set a criterion of 80 beats per minute for satisfactory rate control, and we set being in sinus rhythm as satisfactory rhythm control. And interestingly, there was much more success in rhythm control than in rate control. So for example, 60% of rhythm control was successful and only 47% of rate control was successful.
Now, perhaps that was related to the fact that some people might consider the requirement for a resting heart rate of 80 beats a minute to be a bit tight and a bit over demanding.
Yes, it might, but of course that was the idea of the study, to see if they could maintain satisfactory rate control at 80 beats per minute or less. But I agree that since this study was done, we've had the results of RACE 2, and we know that such tight rate control is not necessarily advantageous.
So in the final analysis, were there more or less events in the two strategies?
Well, you're absolutely right. That's the most important question. And there was no significant difference in the number of events, except for one thing: whether the patients went into permanent atrial fibrillation or stayed in sinus rhythm. And the number who went into permanent atrial fibrillation was 54% with rate control and only 13% with rhythm control. Now this, you might think, is not very important, but I think it is if you've any idea, any notion, any strategy in mind of trying to keep sinus rhythm. If you control them with rate control for any length of time, they will lapse into permanent atrial fibrillation, and it will be more difficult to get them back into sinus rhythm and initiate a rhythm control strategy.
Well, very useful information. I quite agree that registry data represent real-world patients that we see in our practice, and often that differs from clinical trials, and important information, a bit more permanent atrial fib with the rate control strategy, no difference in major outcome between the two strategies. Thanks very much for being with us. For Inside Jack, I'm Tony DeMaria.